good evening or good morning, wherever you are. So as Morvan says, I'm Mark Palmer. I'm Director of International Relations at the UK's Medical Research Council, and I'm Chair of the Strategy Board of the Global Alliance for Chronic Diseases. And on behalf of the whole board, I am delighted to welcome you all to what is our 10th annual scientific meeting. So welcome. Now, as you all know very well, non-communicable diseases impose a huge burden on society and our healthcare services. And the complexity of tackling these diseases is beyond the resources of any individual funder. And it's for this reason that back in 2009, a group of the world's major research funding agencies got together to launch GACD. And the organization, as far as I know, anyway, remains the only collaboration of major research funding agencies that is specifically addressing chronic non-communicable diseases. Currently, we have 12 members, and between us, we represent probably about 80% of the global public funding for health research. And our objectives as a global alliance is to reduce the burden of non-communicable diseases by investing in impactful implementation science research and research capacity strengthening. So far, we have funded projects in 4 out of 5 key NCD chronic diseases. Those are hypertension, diabetes, lung diseases, mental health, and we've also had scale-up calls in diabetes and hypertension. Now, today, I'm delighted to be able to share the fact that we have added to our global portfolio with 17 new projects in the 5th key disease area of cancer prevention. So these 17 projects will take place across more than 30 different countries. We have a total funding of more than $34 million US. So today, I'd particularly like to welcome those of you who are from the cancer project teams, those of you who are able to join us today, and we hope that you can make the most of the networking potential of this meeting. So with these additional new 17 projects in cancer prevention, we're pleased to say that GACD has, since its start, now invested more than $250 million US in research globally. In preparing our new strategic plan a couple of years ago, the strategy board recognized that diseases don't usually occur in isolation. And indeed, the current pandemic is an important reminder not only of the interplay between different chronic diseases, but also between infections and underlying non-communicable health conditions. The COVID crisis has affected all of us across the world in different ways in terms of our health, our socioeconomic and financial impacts. And we know also that many of the GACD projects have faced challenges with delays to research. But on a more positive note, the pandemic has also demonstrated to the public the power and importance of science in tackling major health challenges, with a greater appreciation, I think, of the work of scientists and clinicians working on behalf of humanity. So it's appropriate that in our current strategy, GACD has planned to increasingly tackle not just diseases in isolation, not single disease categories, but in our future calls to take on the complexity of multimorbidity and clustered conditions. And we have a presentation on future calls over the next couple of days, or you can find further information about the funding section, so under the funding section of our GACD website. Now, GACD does more than just invest in individual projects. We support and facilitate networks, such as today's meeting that brings you all together. In fact, the GACD Research Network connects over 600 researchers participating in over 120 projects across more than 60 countries, all working together to tackle non-communicable diseases in low and middle income settings, or vulnerable and indigenous populations in high income countries. The research network includes experts and policymakers, bringing them together to discuss ideas and advance our thinking. And it's through the united action of our research network that GACD can create greater impact beyond what can be achieved individually. So I'm delighted that you've been able to join us today to share in these sessions. I'd particularly like to take this opportunity to thank the Secretariat for putting together an excellent program, and I'm sure that we will have a vibrant and dynamic meeting, and I hope you all enjoy it very much. So thank you, Morvan.
Thanks very much, Mark. It's always great to have a number of our strategy board and our programme subcommittee participate over the course of the annual scientific meeting. Okay, so at this point, I wanted to move on and say that, our annual scientific meeting aims to create a platform for knowledge exchange with and amongst our GACD researchers, our collaborators and funding agencies. And in that light, in this next session, what I want to do is to share a few of the important highlights from the GACD year 2021. And I'll ask for the first slide, which I think, next slide, please. It recapitulates what Mark has been saying, that actually, why are we here? We're brought together primarily around this common purpose, and that's an intent to tackle the immense and growing burden of non-communicable diseases. We know in particular that there are interventions that can work to prevent or control non-communicable diseases in certain circumstances, but there's frequently that lack of understanding on how best to deploy these interventions in real world settings, and particularly amongst those communities and populations who are most affected. This no-do gap can be decreased with implementation science that's designed to understand and advance the uptake and reach of evidence-based strategies. And so GACD aims to fill that need for context-specific global research to inform practice and policy. And we do so primarily by investing in research and research capacity strengthening and working to support the impact of our research. The next slide, please. And again, just quickly reiterating, as Mark said, to date, the joint activities of GACD have meant investment in projects from 6 calls for research, and with the excellent news of the funding agency's latest awards in cancer prevention. We've also, in terms of research capacity strengthening, held 14 implementation science workshops in schools as training events since 2014. And most recently, that happened last year as a virtual event. Next slide, please. But uniquely and importantly, GACD recognizes the collective strength in collaborative science and fosters and supports our project teams as the GACD Research Network. The research programs draw together the projects focused on specific diseases, and the GACD working groups foster collaboration on cross-cutting themes. And we shall hear and participate in activities from amongst our programs and our working groups over the duration of the annual scientific meeting. So it's through this collaboration on mutual goals, exploring new approaches and insights, collectively, we hope to unite our action against NCDs. And importantly, this year, we have been evaluating how effective we are being in this endeavour. You might remember that last year at the annual scientific meeting, I talked about commissioning an independent review of the GACD that would consider just what impact we had made and what likely impact we might anticipate. And in the next few slides, I'm going to weave in some of the highlights and findings of that review. So can we have the next slide, please? So from the impact evaluation undertaken by an independent consultant group, Technopolis, they found a number of key aspects of GACD which were quite heartening to hear, in that they agreed that based on their evidence, GACD plays an important role in the global funding landscape, and particularly for non-communicable diseases. As Mark said, we remain the only alliance tackling this on an international scale, and we have a well-functioning model for collaboration amongst our funders. GACD does fund high-quality NCD implementation science projects of relevance to the needs of low and middle income countries and vulnerable populations in high income countries. And whilst that may seem a bit sort of clear, it's really good that an independent consultancy agrees that this is what we are doing. And we are building capacity in non-communicable implementation science research. Can I get the next slide, please? And this can be summed up in a few key facts and figures about the GACD. We have 12 current funding allies on 6 continents. Collectively, the agencies under the umbrella of GACD have funded 127 different projects on 5 non-communicable diseases with an investment of now $254 million US.
Sure.
Our GACD research network involves over 700 scientists and collaborators in more than 73 countries. And our awardees have contributed. Now, when the consultants were looking, this was 670 publications. This was a 2020 count. Let me say that actually now it's something more like 900. And it's amazing how productive our research network and the research projects are being. Can I get the next slide, please? In exploring the projects and activities more closely through a bibliometric analysis, Technopolis found that the GACD projects and activities have fostered extensive new networks and collaborations, where 71% of publications were the outputs of collaborations with new academic partners, and 49% were the outcomes of collaborations with new non-academic partners. What was also really interesting was that when looking at the new co-authorships as reflected in the collaborations across the publication outputs, overall, there was something beyond 9,000 new connections. But a vast majority of those were actually through GACD networking and maybe not through the particular projects themselves. So this just speaks to the word that actually our networking, our GACD network, is making the most of building new connections. Can I get the next slide, please? And looking at the specific set of publications which reported on implementation science in 3 of the non-communicable disease areas where there had been a significant number of publications, actually we saw that what GACD does is support high quality, multidisciplinary science. And actually, looking in the middle of these statistics here, we can see that we support comparatively much stronger international collaboration in that science. That's looking at the high income and low middle income country international collaboration rate, which is up at 76%, compared to the other world average of only 13% in this particular field. And we do have an excellent gender mix amongst those co-authored papers. So if we like, we will want to continue to collect our publications and our metrics around publications in future, to just keep an eye on how strong our portfolio of publications are. And you will be hearing or have already heard in our program workshops just exactly some of the ways that we want to capture your publication outputs so that they can be shared more readily and easily. The other thing that we also wanted to note is that we are absolutely aware that not everything of practice or policy relevance or value, and that will ultimately have impact, is actually embodied in a publication that makes it into a peer-reviewed journal. Training materials, policy briefs matter. The relationships established within projects and around the network matter. And we'll be trying to capture some of these outcomes into our gathering of knowledge in future. Can I get the next slide, please? To raise the GACD profile further, I wanted to let you know that we, GACD that is, are now reporting on the World Report platform. World Report is an interactive open access database and mapping of global research investments. They're actually capturing the activity of 14 funders at the moment, not just GACD. And World Report is actually hosted by the US National Institutes of Health. But using this tool, you can look at funders, countries, and the organizations in global research activities. And it allows you to actually do some very simple analysis on trends, and actually it can help you find potential partners by understanding which institutions may be involved in particular research. So I just put this up for your information. You can find it on our website, but do go and explore the use of the World Report tool. Next slide, please. In terms of capacity strengthening, we also, the Technopolis, the consultants, agreed that GACD is indeed building capacity in non-communicable disease implementation science research. We have trained now more than 640 early and mid-career researchers through our regional implementation science workshops and schools. And we already have another 52 trainees lined up to join our next school, which will start at the end of this month, not the beginning. Can I go to the next slide? But most importantly, this year saw the launch of our GACD Implementation Science eHub, which provides a comprehensive, free online space for knowledge and skill development in implementation research, but particularly in relation to chronic and non-communicable diseases. Our eHub draws on expertise within the GACD Research Network, and its development has been led by Professor Brian Oldenburg and his colleagues in Australia. The eHub has been funded by GACD, and it will be continuously developed and updated as the field evolves, and with contributions from you, the Research Network, and with advice from the science advisory body that draws from implementation science experts around the world. Next slide, please. So, in addition, impact, as we define it in clearer terms of the burden of non-communicable diseases reduced, will take time. And this is very much so, as much of GACD research is still ongoing. But it was a task that we put to the consultants to determine if there were cases of impact to date, or if there were cases where the research projects that we had supported were actually demonstrating that they were on a strong, likely path to impact. And we asked indeed that the independent reviewers prepare a number of case studies, particularly to help reflect on the key components or those key ingredients that promote the likelihood that research outputs and outcomes will have impact. And indeed, they have prepared a number of these, and we will be releasing these on our website over the next 6 months. But I'd like to say that, next slide, please. We have been working in partnership with the NCD Alliance to help promote our research outcomes. And we've done so by contributing an article to the ongoing Facing Forward series, which captures some of the potential impact that 3 of our projects in particular from our first hypertension call are beginning to have in tackling salt consumption and reducing that in 3 very different environments and contexts. I do hope that many of you may have already listened to this article and indeed visited the several other articles and films on that Facing Forward series. And if you haven't done so, I would of course encourage you to do so, but not right now, maybe after our ASM session today. So what I've been telling you is that I think the GACD network, through its collaborative activities, helps with insights and approaches to our future activities as well. The next slide, please. So whether that's through collaborative publications, the preparation of clinical guideline reviews, which help spot gaps, whether you're preparing the groundwork for future action on multimorbidity. Next slide, please. Or whether the network is coming together to consider learning and reflect on the challenges of the COVID-19 pandemic. Which has been a crisis across different dimensions: health, social, economic, fiscal. It has had a major impact on people living with NCDs, and we have directly heard from you on the challenges that this has brought to the GACD projects that you have been working on, whether that's through delays in loss or redeployment of your staff, and in weakening partnership engagement. Next slide, please. But we've also heard from you that actually many projects have adapted. For example, in the digital health workshop that we held earlier in the year, which explored how new technologies have been used perhaps as necessity to adapt within some of the ongoing GACD projects. We're seeing them being used within health systems, and we understand that actually there are benefits from such innovation. However, we also understand from you, the projects, that we need to be somewhat measured in our immediate response and use of these technologies, because they in themselves can, in certain instances, increase inequity in access and amongst those groups who may already be marginalized. And so we have had a really interesting discussion. The summary of that workshop was captured in a document, which you can, of course, again, find on our website. But what does this mean? Next slide, please. For GACD going forward, we continue to learn from the impact evaluation that has been undertaken, and we continue to learn from the knowledge and insights that you as our research network bring, which include that, of course, in the midterm, COVID-19 will become a very strong context for much of the research, much of the activities that we undertake. That also speaks to the fact that we will be thinking more about multimorbidity, clustered conditions, and those impacts on those living with non-communicable diseases. We will look for and expect that there will be health system changes and innovative technologies that may enable further progress, but we need to understand how best to do this and to promote equity in health. That there are common risk factors that underpin likelihood of conditions, and we need to be better at undertaking prevention. We want to foster equitable international research. We're in this together, and only in this way will we do and obtain the best evidence about how to sustain and support the outcomes of our research. So this ASM, I hope, provides an opportunity for you to engage and connect. And I am going to encourage you to ask us questions, ask each other questions, discuss fully on topics, whether through the chat, whether through in discussion sessions. And I hope that you will bring a piece of you to the activities of ASM as we move through our program today and again on Thursday. And I think that this year, building on your feedback from last year's ASM, where we had 4 days that were sort of multi-hour investments in both science and speakers and talks, that was a little intense. And so this year we decided, as some chefs would call it, to deconstruct our meeting. And indeed, we held workshops for each of the research programs as an opportunity for them to have more interaction between the various projects, have more opportunity for discussion. And what we've done is to bring forward a summary of those workshops for you today. And we're very pleased that we have a number of the research program co-chairs also online to help us with the reflections from the individual programs that happened during October. So I'm going to turn to Izzy van der Eck, who's our Research Capacity Strengthening Manager, who I think is going to share some of the slides of that summary for your information. Izzy, are you ready?
Yes, I'm here. Thank you, Morfin.
Great.
And,
okay, over to you.
I will unfortunately keep my video off just because I'm having a bit of trouble with my internet this evening, but I'm sure you can empathise with that around in different places. So hi everyone, and it's great to see so many people here. And as Morfin said, this morning we had, I think it was over 100 actually in the end, which is quite amazing, and we've got another good lot of people in again this evening. So I'm just going to give a brief overview of the research programs and the workshops that were held last month, and I know many of you were able to join us there. And overall there were 8 workshops, and we had more than 50 live project presentations, and it was incredible to hear the diversity and the depth of science that's going on within our network. And 173 of you were able to join us and engage with those. And we ended up with over 16 hours of collaborative activities, of discussions and presentations and interactions. And I just wanted to thank everyone who contributed to and attended those workshops. We're really grateful for everybody getting involved and being part of those. And there are 2 documents that are of particular interest, and these were sent to you along with the agenda for this meeting and the joining links. And it's the 2021 project updates and the summary of the research program workshops. So now I'm just going to run through some of the highlights from those documents. First up, as mentioned earlier, since 2012, GACD has been funding implementation science targeting NCDs and doing it very well. And projects in the GACD portfolio are currently or have been active in 80 countries worldwide. And these are either locations of implementation or locations of administration or organisation. You can see over here that China and India are leading the way with 17 apiece. But what this map indicates to me is that GACD has activity on every continent, and I think that's something to be celebrated. And if you do check that research program summary document in section 1, there's a breakdown of country activity by research program. So moving on, we also asked you about which step you were at on the WHO implementation research cycle. And GACD projects that started more recently, so for example, those in the Scale Up research program, tended to be earlier in the earlier stages compared to the more established research programs. And again, all of this information is in that document. We also asked you about the theories, models, and frameworks you're using to underpin and guide your research. And on this slide, you can see the theories, models, and frameworks that are used by 3 or more GACD projects, so the most commonly used ones. And the most common one here is RE-AIM, which is being used by 33 projects, and that's followed by the CFIR, which is used by 14 projects. So despite the wide diversity in the project aims, disease focus, target populations, there are points of coalescence and commonality among all of those projects. And again, just to point you to section 3, there is more detail on all of the theories, models, and frameworks used by projects. So there are more than just these most common ones. Now, something that has been new for this year is a publications portal. And we asked you about your publications and your outputs since your project started. And my goodness, you have been prolific. There are lots of activity in this area. And the outputs we asked about were the peer-reviewed journal articles, but they were also the policy briefs, the webinars, the conference posters. And I would just like to thank you all once again for completing that annual project update form. Like, we understand it took considerable time and effort to complete, and we're reviewing how to make it easier for next year. But rest assured, if you submitted your publications already, you won't need to submit them again. And all of those are now in a portal, which is available online. You can click on and explore, and everything's set out in a gallery format. So there's a summary of each publication shown in a block like this. And if you click on that block, then you'll expand the details. It's also possible to interrogate this portal, so you can use sort, filter, and search functions to find specific things. So if you're interested in a particular disease or a year of publication or a type of publication, you can search for those. Now, for those of you who attended the Mental Health Research Programme workshops, you will have heard from Tellini and Bernd, who produced some wonderful insights into publications from those projects. And following their lead, I have looked across all the publications submitted, and I have some summary stats for you. But a quick caveat, these were calculated at the end of October, and since that time I know that the portal has been updated and there's been more activity. So the statistics aren't as fully up to date as they could be, but they do give a good overall impression of publication activity. So the first one I have for you is publications and outputs by year. And we can see that publication activity has increased since the first GACD funding call, with the most productive year being 2020 so far. And you can see from the colour coding how the publications each year are broken down by research programme. So we have hypertension in this sort of grey teal, diabetes in green, lung diseases in orange, mental health in blue, and scale up in yellow. Sorry, my screen just died a little bit there. And of course, the number of publications from each programme is entirely influenced by how many projects submitted updates and how many of those informed us of their publications. So it just gives a general insight into publication activity. Now, the vast majority of publications are peer-reviewed journal articles, which is perhaps unsurprising. And at present, there are close to 800 such articles on the portal, and you can see them, the rough distribution between programmes here. Now, as Morvin mentioned, we are very interested in other outputs and other dissemination activities. And you guys have been busy with webinar presentations, training manuals, conference posters, books. It's a long list of diverse activities. And some members of the research network have been active in the media with newspaper articles, blogs, and radio shows and podcasts. And then there is this other category, which is yet to be sorted or de-aggregated by me. But at the moment, it includes outputs such as websites, infographics, and audio stories. But again, from this, it just shows a diversity across different types of outputs and across all of the research programs. Now, lastly, I want to acknowledge the insightful and valuable conversations that were had during those workshops. And these conversations were as broad as they were deep. And trying to capture the themes and connections across them all was a bit of a challenge, because we want to acknowledge the breadth of the discussion succinctly whilst retaining those complexities. And to help visualize this, we created a mind map. So for those of you not familiar with mind maps, a mind map is a diagram for representing tasks, words, concepts, items, all different things that are linked together around a central concept or subject. And it's all non-linear, so you can see all the connections back and forth. And although I'm not expecting you to be able to read any of this, it's just to give you a general overview of the diversity of subjects and topics that were touched on in the workshops, and also the connections between them all. So from our perspective, just to zoom in a bit, there were a few main themes, such as community-driven research and stakeholder engagement, unsurprisingly, the challenges and the opportunities of the pandemic, adapting interventions, including the use of digital technologies, methodology around implementation research, and sustainability beyond that project timeline. So when your project ends, what happens to your intervention? And there were also some disease or condition specific topics and discussions. And just to say, I'm not going to dive into the detail right now, but I will signpost you to section 5 in that summary document, where each of these branches are shown in more detail. And here at GACD, we do encourage and support that inter-project activity to further the field of implementation science. And as you read through the discussion points, as you browse them, I just want to ask you what they bring to mind. Like perhaps you would like to initiate a new working group, or perhaps you see value in a once-off meeting with other GACD researchers to discuss a specific topic, or maybe you have a suggestion for a workshop or an event. But whatever it brings to mind, whatever your ideas are, to bring them to life, please do reach out to me. It's what I'm here for, it's my job. And I would love to support you to make those things happen. So last but not least, I would just like to flag up the key messages that were submitted by project teams. And these are collated in section 6 of the summary document. And there is some excellent advice in there. There's from your experiences, but there are also offers of support, of collaboration, and invitations to share learning. And these are just a few examples. It's please get in touch, contact us to discuss, learn from research groups, hear from you, learn from your experiences. So please take a bit of time to have a look through those and see if there's any connections that you can make that are available to you already. So that's all from me for now, and we'll move on now to the real stars, the research program co-chairs themselves. So I'll hand back to Morven. Thank you.
Thanks very much, Izzy, for that great overview of the summary outputs of the research programs. But I think actually it's really good that we have a number of the co-chairs from each of the research programs here with us in this session. And I'm hoping that we can start with Francisco Gonzalo Salazar, representing the co-chair of the diabetes research program. Francisco, are you there? We may have a few slides for you to present.
Yeah, thank you.
Hello, hi.
Hi. Yeah, this is the slides. Okay. Good day. Thank you for giving me the opportunity to share this GACD research program highlights 2021. We are the co-chairs Francisco Gonzalez and Dr. Gina Agarwal. We are presenting the main highlights from our program. Next slide, please. Next. Okay. The diabetes research program starts by 2014 with 162 research from 27 countries in 17 separate projects. These projects are working for the last 7 years, and now we have 8 scale-up projects also involved in diabetes projects too. Next slide. We have a lot of projects, but the main of the projects focus in improving systems of healthcare. 41% use mHealth of mobile health technology. 82% involve low, medium income countries and high income countries working together. 41% in 5-year projects and 24% 2 years projects. 35% of the projects are in progress and 65 of them are complete. Next. Yes, in the implementation stage of diabetes projects, most of the projects stay in this step 5 or complete. A bit of them in step 3 or step 4. Most of the projects disseminating outcomes. Next slide, please. The productivity of the research team was increasing in the last 3-4 years. Main of the productivity was in the 2019 with 45 papers. Now we sum a total of 200 of papers in total. It's a great productivity. The next slide, please. By the next November of 2020, we make a survey with 28 questions about the main barriers to work during the COVID-19 disease. This questionnaire was designed and delivered by email to 32 research from January 2022 and we received 21 response from 14 GADC RSM team. Some key response are included. In the next slide, we can see the main responses of this survey. The project participants is the next, and the places of work are shown. The question 1 is, which the following describes how you plan to continue research during the pandemic? The most common response was the project will continue as originally planned, but increased hygiene and safety precautions. The next response was the use of technological tools for patient education will be. Next slide, please. For the question, what are or were the main barriers to resuming research activities for your JDC-funded project? The most common response was lack of internet access at project sites. The next slide, please. For the question, in the geographical region just provide, which the following diabetes service were widely available to patients before the COVID pandemic? The most common answer was medical consultation, medications, and laboratory tests. The next slide, please. For a question, with the following diabetes service continue to be widely available during the pandemic with or without modifications? The most common response was limited medical consultation, most commonly prescribed medication, and glucose monitoring. The next slide, please. For the question, what are some common challenges patients in this region face in self-managing their diabetes during the pandemic? The most common response was limited healthy food option, inability to access glucose monitoring kits, limited place to make exercise, and poor mental health. Next slide, please. In conclusion, we are planning to collect everything for the survey in a short report. It's also important to mention that in this moment, almost all the diabetes group projects are concluded or are in process of scaling up. We must recognize the great effort that it represents to finish these projects with the challenge that the pandemic poses. Important cooperation ties have been generated between the different institutional researchers. This will allow to stay together in the distance. Well done. Thank you very much for the teams that support us. And thank you very much for your patience. Thank you for the time, and thank you for sharing knowledge. It's a great opportunity for us to share, to grow, to improve, to get better opportunities to make research in implementation science. Thank you very much for your presence with me for English. Thank you.
Thank you, Francisco, for taking the time out of your busy day to be with us here for this session and to share some reflections on the Diabetes Research Programme workshop. Now, I don't know if there were any questions. We actually do have Gillian Gould as one of the co-chairs of the Lung Diseases Research Programme. Gillian, did you want to say something, reflection on the programme workshop that was held in October?
Yes, please.
Great, thank you. Over to you.
Hi, everyone. Just like to acknowledge I'm in Australia. I'm on Gacd country, one of the many indigenous countries in Australia. I'd like to pay my respects to the traditional owners of the land here and elders past, present and emerging, and indigenous people on this meeting tonight. For the lung diseases research program, we have 17 projects which were awarded in 2016, which are across 13 countries and 6 continents. Our most commonly used framework is the REAIM, along with lots of the rest of you, followed by the theoretical domains framework. And most of our projects are at step 4 and 5 of the implementation research cycle. My particular project isn't yet, but we're getting there a little bit behind. I think a couple of them are just a little bit behind that. Next slide, please. So I'm going to talk about one of our endeavours from the lung diseases program. I was actually very pleased to see that lung diseases is highly represented in a number of publications. So I congratulate anyone that's any of my fellow lung diseases grantees for doing that. That's a fantastic achievement. So when we last met face-to-face in Bangkok, we decided as a group to write a consensus statement, and there was a concern that lung diseases receive less funding overall, not from the GACD. We're quite happy about how we've been represented in grants from the GACD, but just overall there's a feeling, and I think this has evidence behind it, that lung diseases are not as kind of popular as heart and other organs. So we were concerned about that, and this is pre-COVID, you know. So we wanted particularly to raise the profile of lung NCDs, and we drew up a list of priority topics, and we started some collaborative writing. Now, we have been plugging on at that, but you know, everybody has been very diverted with other crises in the world, and we also were sort of not 100% clearly focused because of the advent of COVID. We started also including some topics around COVID. So we spent quite a bit at the lung workshop talking about this paper and how we should pitch it. You know, should we take account of COVID, which is like the interface between COVID and lung chronic diseases, or should we just focus back on that? And there was definitely a consensus that and renewed interest from that workshop. That was really great to get us motivated and get more people offering help with the paper. But there was a definite feeling of focusing back into NCDs and not, we have written quite a bit of material on COVID, so I think we're going to be splitting off and perhaps having 2 papers. I think we've got one more slide here. Did that other slide go in? Yeah, just to just talk to you about what we're proposing, and we have written to the editor of Lancet Respiratory to ask if they could be interested in our budding paper, and they wanted us to send them an outline. So we have sent them that outline, and these are the topics that we're going to cover. Is the effect of climate change on lung diseases, for example, bushfires, dust storms, vaping and lung health, some of the more neglected lung diseases, multi-morbidity in lung health, and then proposed areas to strengthen with call to action. So we want a bit more about recovery and rehabilitation, palliative care in lung diseases, some ethical issues, and of course, more funding and some suggestions for research directions and implementation science. So waiting to hear back from the author, but we have authors so far from 7 countries interested that we're moved ahead even since the workshop to have a bit more text written. We hope we're going to be close to having a publication in the not too distant future. So if there's anybody else that wants to contact me, I'm happy to be contacted. Even if you're not from a lung disease program, you can still join in if you have a perchance to join with us. So,
thanks very much, Gillian. Really fascinating, really interesting piece of work, I think, that you're proposing. Encourage anyone who has interest in contributing to your proposed article to get in touch with Gillian. But any comments or questions? I don't see any raised hands. You could quickly raise your hand if you have questions, probably the easiest way. If not, just absolutely pop questions or dialogues into the chat to share with everyone, or just go to direct with your questions to Gillian. I'm sure she'll be really pleased to try to help address them if you have. Great, thanks so much. I think we can move now to the mental health research program highlights, and I do think I did see one of the co-chairs, Salini Rajapaksa. Are you here with us today?
Yes, I am, and I think
Salini, hi, good. I was hoping it hadn't been a bit of a mirage earlier in the meeting.
it wasn't.
You have a couple of slides.
Yeah,
excellent.
Talini, did you want to share your screen yourself?
Okay. I could do that.
Or would you like me to do it? I can do either way. I just wasn't sure.
I can share it, not a problem.
Okie doke, hold on.
And Salini, are you still in Sri Lanka?
Very much so, yes.
It's great to understand that we do have a global reach here, even at the ASM at this particular session. Welcome.
Yes, and it's the middle of the day here, so it's good time for me.
Good.
So, I mean, thank you very much for this opportunity, and hello everyone again. And also, Bernd and I will just be giving a little overview of the mental health program through the GACD. And I must start by thanking the whole GACD team and Marvin and Izzy for all their help through the year, especially in preparing this. So when we had a look at the mental health projects, it's really distributed across the world. We have more than 34 projects in different parts of the world, quite evenly distributed, though China seems to be the country with the most number of projects. And when you look at World Bank income, the distribution of projects by the country income status, there's most in the high income countries, but quite a fair distribution in the low middle income and the high middle income countries as well. So quite a varied distribution, and quite a range of topics within mental health that are being looked at in the GACD projects, particularly dementia, depression, young mental health. So it's quite varied. And as Izzy mentioned earlier, when we look at the stage of implementation of these projects, a majority are in the stage of either developing a proposal or implementing their proposal and their project. Though there are a few, there are about 2 that have already completed their project. So that's really good. So at this point, I'm going to hand over to my co-chair, Bernd, who will talk a little bit about the publications arising from the GACD mental health projects. Thank you, and over to Bernd.
Thanks, Talini. Also, thanks to GACD team, Issy, Morvan, and all the others for supporting us. I hope I can be heard and seen. So would you please move the slides, Talini, to the next one? Yeah, this is the Airtable. I think it is about 4 to 6 weeks now that it is on, and this gives an overview of the number of publications per mental health project. Just to mention that projects who have not published does not mean there's no publications from these projects, but they have not entered their publications to the Airtable. So again, please everyone who has a few publications, enter your data to Airtable. And comparing to the mental health workshops, I think it was 4 weeks ago, entries almost doubled. So people seem to be more and more aware of this is something they should be doing, and it would be nice if they would be doing it. I think mental health program has been on for 2 or 3 years now, and yeah, so that would be good to see more of that. You can see that there's a number of publication varies widely across projects, from 0 to the best one 52, most of them between 10, 20. Please move on, Tillini. Thank you. Here I regrouped a number of publications, so you can see that, as I said, some have 0, many have no, back. I think you moved too far. Yeah, many have 1 to 5 or 6 to 10, 11 to 20, also a lot. And the most productive ones in terms of publications. This is not in any way judgmental. It's just showing what there is. There's 4 who have published more than 20. Now, next slide, please, Tillini. Thank you. Yes. Over the years, it has been increasing. You saw the numbers from ISI overall research programs before. They're increasing over time, and most productive 2020, and hopefully more to come in the next year and 2 or 3 years. Thank you. Next one, please. Most of the publications are in peer-reviewed journals, which is good, but it's might not be the most important outcome for implementation. So there is also a lot of other publications. Next one, please. Thank you. We grouped these a bit into conferences and other meetings. There's projects who have been on television a lot, radio, promotional videos. Then the next category is meeting, training, webinars, workshop. All these things are important for implementation. So please also list these kinds of publications or dissemination activities on the Airtable. Then a very important category we think is service user involvement, publications with or from people who have participated in the projects. In the case of mental health, people who have experienced mental ill health themselves and are working now as peer support workers, for example. And there is non-peer-reviewed publications, that's the last category, protocol registration, preprint websites, and translations of scales. Yeah, I think that's it now, Tillini, isn't it? I think that's the last slide, or there's one more. Yeah, that's it. So thank you very much for listening, and thanks, Tillini, and thanks, GACD team again. And that's it from us. If you have questions or comments, please let us know.
Thank you. Thank you to everyone.
Thanks very much, Tillini and Bernd. Bernd, sorry, I hadn't realized that you were also here, but of course you're here.
Yeah, don't worry. There's so many people, and it's no problem. No problem.
Excellent that you've both been here and both been able to chip in reflections from the workshop program itself. And I think, yes, finally, I hope we have Pablo Paral, and I'm not sure, is Josephine here as well at this point? But
yes, I'm around.
Excellent, both. So we have both of the co-chairs from the Scale Up program that are with us at the moment. But I think, Pablo, you're going to take us through your few reflections, yeah?
Yeah, I'm gonna present on behalf of the 2 co-chairs, myself and Josephine. So thank you again, everyone, and again, congratulations to GACD. This is such a fantastic initiative, I think, for anyone working on this topic. I mean, not only for funding, for networking, for capacity building. So keep your good work.
I just saw you on the GACD.
Oh, sorry, it was someone. So Last but not least, I'm going to present about the Scale Up Research Program. 27 projects awarded in the same number of countries across 6 continents, mainly to scale up interventions to manage or prevent hypertension and or diabetes. Again, the most commonly used framework has been REAIM. Next one, please. The majority of the projects are at step 3, that is plan and conduct of the WHO implementation research cycle. Of course, I mean, almost, 2/3, more, probably all of the projects have been impacted by COVID-19. It would be an understatement to say how COVID impacted all the scale-up projects. There was major delays, but also some opportunities, and you can read more in the project report. For example, there was a rapid deployment for the SU-21 and another project that it was reoriented according to the COVID context. Next one. As many of the other research programs, there is an initiative that cut across all the projects. This is led by Rohina Georgi, Mandy Thrift, and Anusha Ramani Chander, and it's about applying system thinking to identify challenges and enablers to scale up hypertension and diabetes intervention, as you can see in these settings. But you're going to hear more about this in today's day 2 of the ASM. Next one. And to finish, I thought it was important to, I'm sure many of you, those that work on hypertension and diabetes, might be aware of 2 initiatives from WHO that I think are quite relevant for all our community. One is the latest WHO guideline on hypertension treatment that has also a strong emphasis on implementation, and the WHO Global Diabetes Compact. I mean, only a few days ago was World Diabetes Day, so there were a lot of events about this initiative that, again, is quite strongly related with implementation and scale up and access and other topics that I'm sure are really relevant for this community. I think that's the last one. Yeah. Thank you very much.
Great. Thanks very much, Pablo and Josephine, for the reflections on the research program workshop. It's great. It was a testament to all of the project teams to preparing the individual presentations that they gave throughout the workshops, which were held over 2 sessions to ensure that everyone could participate possible. Great to have the summary document, and thanks so much to the co-chairs for helping us organize the programs, organize the workshops, plan the content. What we would really like to hear from everyone at the end, and we will be sending around an evaluation, is whether there was a general feeling that this deconstructed ASM, so not having everything in the one session, was the way to go for a virtual program, or whether actually you would prefer to have a 4-day event with multi-hour sessions ongoing. Interesting to hear your feedback on that, but I thought the research program workshops did allow really quite a level of detailed engagement that we had perhaps missed at the last year's ASM. Thank you. Thank you for that. Now we are about to move to and hand over to my program manager, the GACD program manager, Alyssa Chaseville-Ches, who's going to give you some intel on our future GACD calls. Alyssa, you ready? Yes, you are. Okay, great.
Thanks, Marvin, and welcome everybody to this evening or this morning's event. I just wanted to give a little bit of information about our current and future grant opportunities. So the first is just a reminder that our cancer prevention call still has one funding agency that is accepting applications, and that's the National Institutes of Health. Their application portal is open until May 2022. All of the other funding agencies who did participate in this call have already awarded their selected proposals. But again, the National Institutes of Health is open, and they are quite open to accepting applications from a wide variety of countries and nationalities. Next slide, please. So we're also very pleased to be able to announce our next 3 funding call topics. These call topics represent a shift in the GACD strategy. Historically, we focused on disease-specific states, and now we're moving to work that's focused on common NCD risk factor prevention, as well as multimorbidity management. So the call that will be launching in 2021, in just about 10 days, will focus on taking a life course approach to NCD risk factor prevention and reduction. In 2022, we'll again be focusing on prevention, this time thinking about how we can harness the aspects of healthy cities to promote health and reduce risk for NCDs. And then in 2023, we're going to be shifting the focus a bit and focusing on multimorbidity. Next slide, please. So one of the reasons that we decided to announce the next 3 call topics was to help you as researchers begin thinking about the types of collaborations you might want to form in preparation for applying for these calls. So we've just launched in the past week a new tool that will help, we hope will help facilitate collaborations both between researchers and also between researchers and non-researcher stakeholders. Stakeholders meaning policymakers, practitioners, community leaders, those other people who are really, really important for ensuring the sustainability of research and that ensuring that research has impact. And similarly, we've also created a curated list that's brand new on our website of all of a wide variety of stakeholder engagement resources and toolkits to facilitate those types of collaborations and engagement. Next slide, please. Just to go into a little bit more detail about our forthcoming funding call, which will be launching on the 30th of November. So this call again will focus on NCD risk factor prevention reduction. And the way it'll work is that applicants will be asked to focus on specific critical life stages, critical in the sense that they're very important for interrupting future risk of NCDs or reducing the progression of existing NCDs. About half of the funding agencies that will be participating in this call will require a focus on young people, so people ages 10 to 24 years. During the call launch on the 30th of November, we will also announce which funding agencies are participating in the call. And next year in early February, we don't have a firm date yet. We will have a webinar to go into more detail about what's expected and how to prepare a really good application for that call. And while the closing deadline will differ, not too much, but there will be some differences between the funding agencies. For most, it will close between April and May 2022. So there will still be time, plenty of time to prepare the application after that webinar. So that concludes our presentation.